Next, we have a lecture on importance of fasting and diet in metabolic diseases by Dr. Pradeep Nair. He's BNYS MSc, PhD in Health Science, Professor and Head of Research in Sant Hirdaram Medical College Hospital, Bhopal, Director of Research and Operation of Indian Academy of Scientific Writing and Research from Pune. He has authored a textbook called The Science of Naturopath, A Leap into Evidence-Based Naturopathy. Of course, many more to go with you. He was also a co-editor for our book called Clinical Ozone Therapy. So thank you. And let's hear from you on fasting.
So good morning, everyone. So after a nice feast, so we'll think about fasting. I have been listening for 2 days. I call always Melisha ma'am as Taliban because we cannot say no to her, and that's how she brings the best out of all of us. And in the past 2 days, what we are witnessing, from the songs to ozone to pranayam and a lot of many things, and a real integration is happening in this dais. Why this fasting we have to speak over here is like most of what we have spoke is about, we have spoken about a lot of ozone, we have spoken about giving Ayurveda, we have spoken about giving modern medicine and different kind of things. But ultimately what we require, or a patient what he require from a doctor is independence from his disease. He do not want to continue forever any kind of disease. So what we can actually give him as sustainable, like if it is like, now we are standing here and we're speaking that patient, this patient. Tomorrow imagine somebody of your own or you becoming ill. At that point of time, you do not want to pay from, if it is 400, 500 or 1000 rupees, we don't want to pay that forever and ever. So there are something which we call it a salutogenic approach, where we have to build on those resources which is going to be meaningful in that person's life, where you as a doctor are contributing to have a perfect health forever and ever. So there is clinic is not existing in his life forever, and we will not go out of business. If you see the statistics coming out every year, irrespective of we all are here, irrespective of International Yoga Day for 7 consecutive years right now, irrespective of so many integrative physicians coming out, diabetes is increasing and we are still the diabetic capital. The hypertension is every year, it is increasing by 10 crores, and cancers, it is increasing. Every 3rd woman in India is having a cervical cancer. So we are not really actually creating any change, irrespective of we are creating some changes here and there. So what we are lacking over here is we are forgetting to fine tune what patient can use themselves at their home. And if you see the morning session where Dr. Renu Mehta was taking, the one thing is for pranayama, you have to just learn from someone and get fine-tuned it occasions in between to get fine-tune your practice. It's not going to put a big hole in your pocket as a patient, from a patient perspective. And there are many such meaningful healthcare practices which India is owning and India has been doing for a long time. And unfortunately, because of our convenience, we have changed. If you take the fasting, for example, so I have been in Maharashtra for more than 10 years now before I moved to Bhopal. So here, every 3rd day or 4th day, because we are very religious in Maharashtra, every 3rd or 4th day, anybody I meet, if I offer him some food, today mala upwas chalte aaj. So if I ask them, and they are eating sabudana vada, and they are eating dahi vada, and they still call it as fasting. So fasting, and if you see Ramadan fasting, another one most spiritual fasting, which it's a hard fasting which you need to take. But if you see the most of the studies, the kind of calorie intake, and I myself, my PhD, I have done one comparing healthcare fasting as well as Ramadan fasting. 2,600 kilocalories was the daily intake during the fasting, whereas in the normal it was 1,200 to 1,500 calories. And the kind of sugary drinks and the time change. And fasting is meant to build you spiritually as well as you physically, but we are doing it in the different way. So it is there already in the practice. Yeah, so fasting is not something very new to us. Like now, if you see most of the researchers, National Institute of Health or National Institute of Aging, what they're doing, and it's coming from the West again, because it's a very Eastern practice and Middle Eastern practice what fasting is. But from anecdotal times, we have been fasting for so many reasons. Shiv ji ke liye fasting karte hai, Allah ke liye fasting karte hai, or Jesus ke liye fasting karte hai, and it is meant for ourselves. But later, it has actually health promoting benefits as well. But we have forgotten that, and we have added our own things into this kind of fasting. And the fasting is actually become a feasting nowadays. There is no fasting existing in what we are doing. We are actually having more food. Or if you're putting somebody on fasting, or you are fasting on a day, the next day you will be thinking that kal maine pura khaya nahi tha. I have not eaten anything, so I'll eat something else more today. So that is how the fasting is being happening. And in the previous days, it has been always like if you want to do something spiritual, you fast for a day, or you are on water fasting for the whole day. So you do different things like that. And these were meant for some kind of religious approaches, but also they have medically pleasing benefits also. And this is one of the sustainable resources what we can offer to our patients, because until and unless the house is clean, whatever therapies you are offering, be it the ozone, be it any kind of XY drug, it is not going to work in the patient. That is why if you see, I have always this question as a physician or a researcher, why every patient is not reacting to the same way to the same drug? If you give rectal ozone, everyone will not react in the same way to the same dosages or the same kind of therapies. You have to invent something. And that is why naturopathy we call as the unity of disease and unity of cure. That means every person is a different person. Like if I see my psychosocial factor, my individual factor which is there within me, it is not the same way for the other person. So we need to identify that root cause where it is promoting the inflammation, it is promoting whatever therapy you are giving the patient until unless he is receptive. His body condition is not receptive, it is not going to work. And it is going to be a universal fact, how much ever we hide it. If you see, you have shown all the successful cases, but there are many non-successful cases also, and everyone will agree to this particular fact as a physician, because it's a close group and we can criticize each other. So those unsuccessful cases where it was not responding to what we are doing, and I am again not promoting fasting as the one that thing, it is one among the many things which you should be integrating in your practice for meaningful benefits in a patient, because like yoga, fasting also can make changes in your personality traits. Like what we have in Sattva, Rajasic and Tamasic, we can make those changes where Sattvic Guna can be dominated when we are doing fasting, and there are enough amount of research to prove that particular things. Okay, and usually nowadays if you see, fasting is only connected to weight loss. Fasting, if you want somebody to fast and if you go to the naturopathy hospital, most of the people come like, I want to reduce weight, or I want to reduce my diabetes, or I am putting some extra inch on my belly, I want to reduce that belly button. But fasting is not just meant for those weight reduction, it has some benefits beyond that. And if you see, this is a current evidence in 2020, it got published, the types of fasting we have overall a period of days. There are very lot of types of fasting which is available now, based on how our patients can cope up to. Like everyone cannot be on water fast, everyone cannot fast for 7 days long. There can be different types of fasting, starting from like calorie restriction, where you are not worried about what food they are eating, but you will be reducing their calories, like you to say 800 to 900 calories per day, irrespective of what they are eating. And then it is called intermittent fasting, which you choose to do alternate day fasting. It is like 1 day fasting, 1 day you will be eating, or you will be doing something called time restricted feeding, where you will be like seeing like, I am following a time restricted feeding diet where I don't eat for around like from the night 7, 8 o'clock to next day around 12, 1, I won't be eating anything. I'll be just on waters, and I'll be eating, my window period of eating is 8 hours. So you give yourself a period for 16 hours of non-eating and 8 hours of eating, that is called time restricted feeding. Then you have periodic fasting, it is like 5 days you will be eating and 2 days you won't be eating. And then we have long-term prolonged fasting, which you ideally do in a setup under medical supervision. Like naturopathy hospitals, we do that for a longer time, from time ranging from 7 days to 21 days people fast in our hospitals. And then we have water-only fasting, which is again proven to be a very good fasting. Again, you have to do it under medical supervision. Then we have something called zero-calorie diet, which is again from a westernized model of diet, where they give mini snack bars, which does not contain, like a diet Coke you have, similar kind of thing. And very low calorie diet, where the calorie intake will be very, very low, less than 200, 500 calories, which will be giving. And there are something called fasting mimicking diet, which is like you will give a lot of salads and things like, where we will be concentrating on those kind of food which we should be taking. So these are the different types of fasting practices available across the world, and based on what your patient want to choose. Or you can actually integrate it with their religious beliefs. And you can make their fasting during Ramadan a better experience. You can make the fasting they want to practice during any Shivaratri, Amavas and all those things. You can make it an enriching medical experience where they are getting those benefits out of that. And if you move further, whether fasting has any kind of intracellular benefits for our body, definitely it has a lot of intracellular benefits, and it is why this is not very much popularized, because nobody can encash money from this for a longer time. If you advise fast, the kitchen is yours, the fruits are yours, the drink is yours. No doctor is going to get money unless those consultation and the kind of mentoring you give to maintain their electrolytes, to maintain their blood pressure or the vitals you need to monitor. If you see how humans respond to fasting, it is published in the leading New England Journal of Medicine. It's a Bible of all medical journals. 1880 onwards, 1800 onwards it is publishing. It is just 2019. Now they are accepting these kind of practices as something meaningful. If you see, it can minimizes the anabolic process like synthesis, growth and reproduction. Body gets a complete shutdown and rest when you are in an intermittent fasting. And it also favors maintenance and repair systems and enhancing the stress resistance to the body. And why I told about why we need to clean the house first, because until unless the stress resistance is reduced, like we may say that you are spending only 100 rupees, but he may be earning only 900 rupees on that day. He need to meet his expenses, and there are other doctors he might be missing, because we are a pluralistic practicing country. Irrespective of you going to a homeopathy, he'll be also going to a Ayurveda person, he'll be going to an allopath, and he'll be meeting somebody under the banyan tree and getting treatments from them as well. So it can improve the stress resistance in the people if they are fasting, and recycling all the damaged molecules, stimulating mitochondrial biogenesis. Mitochondrial biogenesis is very, very important. It is one of the 8, it is one among the 9 leading factor for anti-aging, where we lack mitochondria over a period of time as we age. And also it promotes the cell survival within the body. So this is the generic effect of fasting. And if you see, what are the metabolic adaptations we do when we fast in our body? So energy restriction just for 10 to 14 hours, it first depletes the liver glycogen and hydrolysis of triglycerides and to free fatty acids. And whenever a patient is fasting for a longer time, you can always see the body is, irrespective of the patient is willfully fasting or he is starving, body considers it as a starvation. So the first response what you get when a patient is fasting is shock response, adaptive cellular response to fasting, which is a shock response. At that point of time, you can see every parameters in the body go haywire. And you should not be worried, and you should be very patient to see how the fasting is progressing. And we call it as healing crisis in a naturopathy terminology, where patient experiences whatever he has already been through during that fasting period, and it subsides normally at the end of the day. So what happens when this particular thing is happening? Your LDL levels, HDL levels, all the kind of parameters are going to increase. The patient should not be in a panic mode. And more of, if you see, we as a group of doctors, we have started treating the laboratory reports. We are more into laboratory reports, less into the patient. Okay, and now thanks to we have clinical decision making systems also available in modern medical hospital. You don't have to see the face, you just put the ICD diagnosis, the entire plan for next 15 days will be popping up, and you take a printout and give to the patient. But here it is not in the same way. The cellular response will be different in different persons. Somebody will be experiencing pain because the inflammation is going to go up. The cytokines are going to go up during the midway of fasting, which will be the peak. And then it will be slowly reducing by the end of the fasting, whatever you're planning and you're reshuffling. And then there will be reduced glucose levels and amino acids during fasting, result in reduced activity of the mTOR, which got a Nobel Prize in 2016. We have been doing fasting as a country since ages. So mTOR mechanism, when it shuts down, it stimulates autophagy. And in autophagy, there is another one process called mitophagy, which actually works on the mitochondria and remove all the debris from the mitochondria, which leads to oxidative stress and the excess amount of reactive oxygen species in the body. And then the ketone bodies, which develops during the fasting. And if you look from a hardcore modern medicine perspective, whenever you see ketone in the urine, you will be startled. He'll say that, oh, you are going to get ketoacidosis and you are going to die. And the reason one of the patient is diabetologist scared him, like the ketone bodies are there in the urine, you should get yourself immediately getting off whatever like gimmick you are doing, you should come back to us. So, and that is because the patient was not taking anti-diabetic medication for the past 7 days, and they were clueless how a chronic diabetic patient can be without his medication for 7 days, that too without eating anything, or on a low calorie diet. So ketone bodies is something which is going to help, and it will be enhancing the organ function. And during the 3rd or 4th day of fasting, when you are in a prolonged fasting, the ketone bodies generation will happen in the body. And if you see, this is the systemic effects of fasting again. Every part of the body is being actually triggered while we are doing fasting. So much so that there will telomerase change, because it's one of the most anti-aging therapy which we can use, starting from your hippocampus, and starting from your brain, from the brain stem, including your liver, your intestines, everywhere there are changes. That's why people are not necessitating any kind of medications during fasting, or we are able to, like a lot of diabetic patients fast in our medical college hospital in Bhopal. And by the third day onwards, they won't be requiring any medications for themselves because their sugar level is so low and they are able to match up without any medications and insulin what they are taking. That is because it increases the insulin resistance. How it works, I'll explain in coming way. But if you see, fasting is something like a periodic fasting, like one day fasting in a week, or if a person can be on a time restricted feeding where his eating period is very low and the non-consumption period is very high. So we can actually reverse a lot of conditions in that particular patient, irrespective of whether a patient is having a disease or not having a disease. How you advise, like ozone therapy should be taken with diseased or non-diseased. Similarly, fasting is something very cultural and it is very much necessary for our body. So it can create these kind of changes like decreased insulin sensitization and insulin growth factor reduces while you're fasting, and also glycogenolysis happens. And also we have seen that there are studies which says that like nowadays the problem is not about non-availability of insulin. The problem is non-utilization of insulin. And non-utilization of insulin happens because your muscles are not able to uptake those and the blood transporters are not working really in your body. So fasting through it, autophagy and through the other other promoting reactions, it can actually increase the uptake of glucose by your cells so that your blood sugar is going to come down, or any kind of XY diseases it's going to come down while we are going fasting. And also we should monitor as a doctor, the most scary thing which will be told to your patient will be the electrolytes. Okay, so previously one of the famous, like just 7 days back in a Kerala in a hospital where I am scientifically supporting them for fasting. One of our famous personality, Dr. Shashi Tharoor, has been taking fasting for 7 days. Okay, so his sodium level went to 130. So his diabetologist is one of the famous diabetologists in India. He was a very famous person. I'm not taking his name. So when it went to 130, the entire medical team is a very big bureaucrat, Shashi Tharoor, for all of that matter. So they told that your sodium is 130. You should go, your cells will now start swelling up because there is going to be reverse osmolarity and you are going to actually you are going to a hypovolemic shock. So you would be requiring an IV. So he got scared all that time, and then again he came back, and then we had supplied enough amount of evidence how fasting is going to be safe and what happens to electrolytes. When you are not giving any sodium externally while you are fasting, obviously your sodium levels are going to come down, and it's a very safe practice under a doctor when it is supervised properly, your electrolytes are properly taken care of, and you can easily fast. What happens, like we do not have as a communities, our threshold level has gone down like anything, like the moment we know all this, like 2 days we are getting ourselves into COVID, vaccination and all those things. But the moment we go back to our livelihood in the original place, our threshold will come back, like we are not having pain tolerance, we are so much averse to death. And in yoga, we call it as abhinivesha, the fear of disease and fear of death, which is one of the things which is called as a klesha, which prevents the progression of your life. So we as doctors, we should not be disease mongering. We should not be putting those fear into the people, and we should not be very much laboratory centric. Laboratory centric is very, very bad thing for our profession as a doctor, because we do not have 120/80 for every patient. We do not have 130 milligram per deciliter for every patient. Every patient is different, and I'm very sure you all will agree with me. So at that point of time, what you should be really looking is like when you are not supplying sodium, your sodium is going to go down, your potassium is going to go down. But you should note that it is not an alarming level. Alarming level is not defined by the number. Alarming level is defined by the consciousness, time orientation to the patient, and how you are supporting to the patient. And there is a study which is conducted to check the placebo versus morphine's effect. Okay, war-injured prisoners have been given placebo one arm and morphine on another arm. When we told that placebo group that this is a very good potent drug for analgesic, and the other group told this is a placebo. Morphine did not work, then placebo worked. So there is a book called Placebo and Nocebo, where you need to read, like most of our role is to give that resilience to our people. Like because the patients come and expect from us what this doctor is telling. You are not going to scare them. Your sugar has gone down, you're going to die. If you're saying that it's okay to have that kind of sugar levels, it's a stress response what you're getting. Because all our sugars will go up and down when we are having those kind of adaptive stress responses. And that is where we are there to be as an integrative physician. We are not putting a hole in their pocket. So your sodium excretion will be increasing while you are fasting. Many patients will be even getting urine retention. They will be stopping urinating for a while. So we don't have to be panic at that point of time. It's a reaction to the body. You need to just supplement with enough amount of water and whatever calories that particular patient is meant to. Like if you are planning for a 500 kilocalorie fasting, maintain supply of that proper kilocalorie, and you can take additional supportive eliminative therapies, like you can go for a cold wet pack, or you can ask the patient to just go in sun for 10 minutes, which is very beneficial for that particular patient. So that such kind of activities can be done, and electrolytes depletion is one of the most important thing happens during fasting, which we should not be scared of. And this is from our own study, which we are observed, what happens while during diabetics. Okay, so when a patient is on a long term on metformin, what happened to them is, like, by default they'll go to vitamin B12 deficiency, long term complication of metformin. And also, why diabetes in first place? Diabetes is happening because the insulin production and insulin sensitivity is a problem in our body. And for insulin production and insulin sensitivity in our body, we need vitamin D. And vitamin D will not work alone, we need calcium as well. So that will stimulate your pancreatic beta cells to produce more amount of effective insulin in our body. But by default, 93% of Indians are vitamin D deficient, and we do not have vitamin D in our body normally, generally for everyone. Okay, and for Shashi Tharoor, when he underwent fasting, his vitamin D went to 45, okay, after fasting, on water fasting. So, since medically supervised fasting, when you do, what happens, it increases the vitamin D, so it removes all the caught vitamin C's from your adiposity. 10% of weight reduction will increase 33% of vitamin D without any additional supplementation. It's a clear-cut study. 10% of your normal body weight reduction. Okay, it will increase 33% of the vitamin D in the body. So when the vitamin D increases, your calcium absorption from the intestine requires vitamin D's presence. Without vitamin D, the calcium absorption will not happen from the intestine. So there is protein called calcibindin, which actually absorbs the calcium from the intestine in the presence of vitamin D. And vitamin D, when it is improving the calcium, and if you see for metformin related vitamin B12 deficiency, the common treatment we prescribe is calcium supplementation. So in our patient, 26 patient, what we observed in our clinic who underwent fasting, their vitamin D levels increased, their calcium levels increased, and simultaneously B12 levels also gone up. Because calcium, why you are providing, in the presence of calcium, the intestinal absorption of vitamin B12 increases. So fasting can be a single shot solution. Increases your vitamin D, increases your calcium, which increases your vitamin B12. And what vitamin B12 does to our body? Your cognition, which in diabetic patients, you will have confusions, you will have cognition related issues, which happens over a period of time, long-term use of medication, as well as when your nerves, things are not working for a longer time, this is the complication which happens in the body. So simple fasting can reverse this particular thing. And along with that, again, I'm not promoting this is the only thing which you should be doing. For receiving good fasting, the patient should be in a right frame of mind. He should have other supportive therapies, whatever you are expert in, what you're giving, it should be given. But along with this, fasting can be given for diabetic patient also. If you see this particular image, the outer ring is for your blood sugar levels. So this is the pre-data, when the vitamin D level increased, the blood sugar level decreases automatically. When the vitamin D level increases in the body and your blood sugar level decreases in the body, and this is currently under consideration in medical hypothesis journal because we have only 26 patients data over here. So initially 2-3 main journals rejected this paper because you do not have a control group. People don't understand, many a times control is in our mind and body, and we need to fight with that journal, and it's a process of publication. Whenever you go as you feel something is very great, but they don't feel in the same way. That is a common thing which happens, but still, meaningful changes happening in your patient. And the mechanism what happens inside is this: your vitamin D goes up, calcium absorption increases, B12 absorption increases, the patient is going to get normal over a period of time. And vitamin D supplementation is recommended as one of the standard therapy in diabetes also to prevent the complications of diabetes. And another one study from UK, which is published again in Lancet in 2019, the patients who underwent a calorie restriction for 825 to 853 calorie per day reduced their body weight. They have complete remission of their type 2 diabetes mellitus, and they stop all medications. This is called direct trial, which is published in Lancet in 2019. Okay, so these kind of studies are already available. Around 50% of the participants reduced. They were not requiring diabetic medication after this particular amount of 3 to 4 months of calorie restriction for 800 to 850 kilocalories. And they followed up the same patient. After 24 months also, 1/3 of these people sustained this benefit. Because it is not like that once you fast or being on calorie restriction, if you're going back to the kind of again routine and things like that, it is going to create that kind of issue. And now I'll just put across each diseases why fasting you can propose. if you see fasting and cancer, there are good amount of evidence available in fasting and cancer. So much so that fasting can make your cells specific to your chemotherapy. Like chemotherapy, usually the problem is it damages both the good cells and bad cells. So, and this is in 2021, recent publication in the Cancer Clinician Journal with a 256 impact factor. This particular paper got published. Fasting, without fasting, if you give chemotherapy, it will be damaging all the cells. But if you combine fasting, intermittent fasting with chemotherapy, or fasting mimicking diet with chemotherapy, it will be increasing the specificity of your chemotherapy. And also, fasting is also a single kind of treatment given in naturopathy hospitals, but they do not understood the mechanisms behind it at that point of time, because it was not that specific, because we do not get funding for this kind of research, because there is no pharma interest beyond the patient interest in this kind of researches. Okay, but now we have applied for a funding for 70 lakhs, hopefully we'll get. So if you see, the prolonged period of fasting increases the normal tissue loss in your body, and also the fasting decreases the tumor growth factor nutrients, and including the glucose supply. The glucose supply is one of the major problem in almost all the cancer cells. Fasting removes the glucose supply to the cancer cells, and it induces anti-Warburg effect by reducing the glucose uptake by glucose transporters and aerobic glycolysis, and forcing cancer cells. The cancer cells will be forced to produce an oxidative stress like reaction. Yesterday somebody was telling like a good amount of oxidative stress is a beginning. But here the cancer cells, when you are fasting, it promotes oxidative stress in that, which increases the production of reactive oxygen species within the cancer cells, and eventually it is forced to die. That is, apoptosis will be happening by the end of this thing. And this is a very proven reference in 2018 in Nature Cancer Reviews. And the slides will be available, and those who are interested in treating cancers can be utilizing this as one good therapy to be integrated into your practices. And fasting and hypertension, when you see, we have the DASH diet, which is diet against stopping hypertension. We have DASH diet, which is given, which is very famous. And if you see the fasting and DASH diet comparison, all the systolic blood pressure, diastolic blood pressure can be reduced with if you are combining fasting along with DASH diet. Irrespective of the type of diet you're giving, if you're combining fasting along with DASH diet, that can significantly improve not only the single time diastolic or systolic blood pressure. Your 24 hours ambulatory systolic blood pressure is also under control. That means it is giving a sustainable benefit to your patients when you are doing with hypertension. And for hypertension, water only fasting is one of the best practice which we will be like advising, but it need to be done under supervision. And if you see, when your body weight decreases, this is from our own study which we published in 2022, when your vitamin D levels increases, your body weight decreases. That is a combination, like when you reduce your body weight, you are going to increase your vitamin D. For any patients, every patients, whatever you want to do, if they are obese, and we look into a different way, vitamin D is responsible for obesity, vitamin D is responsible for hypertension, vitamin D is responsible for dysbiosis, but it's like a philosopher's eye. Like if you look an elephant from back, it looks like a wall or a tail. It's by holistic means, you should consider everything together, not like a tail or a trunk or a wall. It should be like we cannot know that whether the chicken came first or the egg came first, you know. So it is all the story like that, where we need to do whatever is the best for the patient, and this is one thing which you can promote to your patient. And also how to fast. So this is my last slide, and this again if published in 2022. Like why I'm saying the year, the acceptance is happening recently, last 5 years. If you see the number of papers published in fasting, if you go to PubMed and see, the last 5 years, there is around 30 to 40% increase in the fasting and calorie restriction related paper. Because now the West has exhausted all the medicine kind of researchers, and now they have started with yoga, they'll call it as stretches, breathing, they'll call it as sustained breathing stretches. And then recently published in American Journal of Heart Association, they call it as stretch exercise. I have 5 more minutes, 5 minutes, overtime, okay, I'm done. Okay, so you have two types of fasting which you can give. One is about calorie restriction, another one is time restriction. In calorie restriction is about what we eat, we need to watch. And macronutrients, it will be low calorie diet or very low calorie diet. It can be carbohydrate, fat and proteins you will be giving in a combination for 800 kilocalories based on whatever you want to give. And you have fasting mimicking diet, where you will be giving similar type of diet which is not exactly fasting. The people will be feeling good. They may be having one chocolate sandwich a day but not anything else. That's the kind of treatment people gives outside. But you have the other side, time restricted feeding, where you have intermittent fasting, or the time restricted feeding. Here it is alternate diet fasting, or 5:2. That is 5 days you will be eating, 2 days you won't be eating, or 1 day feast, 1 day fast. 5 days feast, 2 days fast. And they have time restricted feeding, which is coming up really well nowadays because it's a sustainable way of doing. Where you will be eating either between 8 a.m. to 5 p.m. and not eating anything after that, which Ayurveda also suggests, I guess. And then we have something called 10 a.m. to 7 p.m. That is the window you will be eating, or it is after 12 p.m. to 7 p.m. or 8 p.m., which I follows right now. Okay, so this is how you can integrate fasting, and that's it. Thank you for the opportunity.
So Dr. Pradeep is doing PhD on fasting, so he'll go on and on. We have to cut you there. Thank you. Huh.
So what we basically try is, ma'am, like they will be under supervision, and when they go home also they'll be there. What we will give is like in normal diabetic patients what they eat.
But in a time restricted.
So normal diabetic patient, irrespective of diabetes, when you say fasting, you will be alarming. But if you see their home, they eat chapati, rice, everything normally as a normal person. So we give the same with a limited quantity. Where we have a quantity like you give salads or kind of some fruits or some juices, which is going to under 800. So it will be a gradual fasting. Starting from 1000 calorie, gradually taking up them to 500, under 500, and it depends upon, insulin is depending upon his blood sugar level. We'll be checking his fasting blood sugar every day.
If you're on fasting, you
And
should
we
check
will
your blood
educate
sugar.
the patient also to check their random blood sugar, and we give them a prick whenever they want to prick, they can check and do.
When I do fasting for my diabetes patients, I have a CGM.
Okay. So
Pradeep
I
ji,
request Dr. Amelia to...
Millie ji, 1 minute. Pradeep ji, you have mentioned that when you give them low calorie diet, that is my experience. If you maintain the sugar level between 60 to 90, immediate within 7 days, if there are cancer progression, they will report you that we are feeling better. That is my experience. You mentioned calorie restricted diet, where you tell them that you can eat carbohydrate in a low restrictions, where we maintain, because we are Ayurvedic people, we maintain clarified butter. It is a high calorie, but we found the same result. So is there any, like, your experience that with clarified butter, different herbs, and still the fasting is happening? And
Yeah, so there is an ideological difference in terms of naturopathy. We are against milk and milk products to an extent. We don't allow them to eat milk or milk products per se. And for us, no, we won't be prescribing in a typical. But again, you have different types of naturopaths from different overseas experience. They practice in a different way. But what we do is, like in naturopathy per se, we don't just look into the reports. From the first day onwards, we don't treat disease and health as a different entity. It's a process. So we tell them, you are no more diabetic, you are so, and you are Parul Sahiba. You are not a diabetic patient for us in the first place. So from there, the journey starts. Thank you.
Hello. So Dr. Amelia, please, well, official, is that coming in your way of getting up? You can sit here on this side, huh? I just saw you there. I also stand.